Another practice question for today. So, which two conditions make up chronic obstructive pulmonary disease, or COPD? Select all that apply. Is it 1, asthma, 2, chronic bronchitis, 3, emphysema, 4, pneumonia, or 5, tuberculosis? So I'm going to give you all a few moments and just select the ones you're thinking here. All right, so our answers here are going to be 2, chronic bronchitis, and 3, emphysema. So remember, chronic bronchitis is characterized by that really congested cough, and emphysema is characterized by those damaged air sacs. Remember, the patients have a dyspnea here, or difficulty breathing. Now, you may see at the bottom here, I have our COPD alphabet, and that's the memory trick I'm going to share with you all. So let's look at our 4 letters. We have COPD. Now, what letter comes before C? B. B for bronchitis, to help you remember that chronic bronchitis. And then let's look at our letters again. We have COPD. What letter comes after D? E for emphysema. So I like to think of it as B, COPD-E, to remember bronchitis.
So a nurse is assessing a client with the acid-base imbalance. Which of the following most likely contributed to the client's metabolic acidosis? 1, a panic attack. 2, chronic obstructive pulmonary disease. 3, suctioning of the NG tube or nasogastric tube. Or 4, undiagnosed type 1 diabetes mellitus. What are we thinking here? If you guys chose 4, you are absolutely correct. So let's walk through this here. So clients with undiagnosed type 1 diabetes are at risk for a complication called DKA, or diabetic ketoacidosis, which can put them into metabolic acidosis. In DKA, there are too many ketones built up in the body, and the ketones are an acid. So let's walk through the other answers here. So if someone is having a panic attack, likely they're having rapid, shallow respirations and breathing off CO2, which will put them in respiratory alkalosis. COPD may have impaired gas exchange and therefore be at risk for respiratory acidosis. And frequent NG tube suctioning can suction out the gastric acid and lead to metabolic alkalosis. Question here. A client with emphysema may present with all of the following symptoms except what? A, a barrel chest, B, productive cough, C, hypercapnia, or D, hyperinflation of the lungs. What are we thinking? If you guys chose B, productive cough, you are absolutely correct. So remember, patients with emphysema would present with hyperventilation. The body will try to compensate for those low oxygen levels, and which will cause the patient to hyperventilate. And remember, guys, here, emphysema patients are sometimes called the pink puffers. They will have that barrel chest due to the use of the accessory muscles for breathing. They'll have the hyperinflation of the lungs due to the damage of the alveoli sacs and the air sacs. And they'll have the hypercapnia due to the high carbon dioxide levels. So if you guys chose B, productive cough, you are absolutely correct. I am so proud of you.